All right, so we're going to be doing the CAM evaluations for the foot and the ankle and the lower leg. And so the first one that we're going to be doing is straight leg tallow curl plantar flexion. So I'll have the patient laying supine on the table. Their foot's going to be just hanging off the edge. Actually, scooch up a little bit down towards me. There you go, right there. And so we'll have the patient supine. I'll be sort of cupping the heel here and asking them to plantar flex or point their foot down towards me as far as they can. So we'll actually start that from a neutral position. So we'll have them start about right here, and I'll go ahead and point all the way down. Good. And then I would assess that on both sides. The next thing we can do is assess the straight leg tallow curl dorsiflexion. And so we'll have the patient start in that neutral position, and you're going to pull your foot up as far as you can. Good. We're going to just watch and see as they actively pull their toes towards their knee, and go ahead and relax. The next assessment that we'll be doing is ankle plantar flexion with adduction and inversion of the forefoot. So we'll have them come up into that half calf position, and so their foot will be right about halfway here. So they're going to plantar flex, they're going to adduct, and so they're going to just kind of bring their foot in as far as they can. Good. And back out. And then we'll check with abduction and eversion. So that's from that same position. They're coming from that neutral position, pulling their foot out as far as they can. The next CAM that we'll be doing. All right, so the first muscle that we're going to be assessing in the lower leg are the medial fibers, or the medial gastrocnemius. And so in order to check or assess the gastroc, we'll have the patient actively bring their hip up to 90-90, 90 at the knee, 90 at the hip. They're going to back that hip flexion off to about 45 degrees, keeping about 90 degrees of knee flexion. They're going to go ahead and fully plantar flex and fully invert at their tibia, so full plantar flexion, full tibial inversion, and they're going to resist as I try and pull their leg or their knee into extension. When I say go, resist, ready, go, hold, 1, 2. If I notice or test any weakness, I'll have the patient lay on their belly, so they'll flip a face down to perform the DFAMAT, which in this case we have a couple different points that we're going to palpate. The first point is the medial femoral condyle, the fibers at the origin of the muscle on the inside. Then we'll slide distal down to the myotendinous junction, right where those medial fibers start to form the Achilles tendon. We'll palpate there, and then we'll slide fully distal to, I'm just going to lift her leg up so you can see, distal down to that medial part of the calcaneus, where that Achilles tendon inserts onto the calcaneus. Once we perform the DFAMAT, we'll have the patient turn back over on their back into the supine position. We'll bring them back up to 90-90, back that hip flexion off to 45, drop that knee back down to 90. We're going full plantar flexion, full internal rotation at the tibia, and they're going to be basically pushing their heel into my hand at 10% effort for 6 seconds. Ready, pull in. 1, 2, 3, 4, 5, 6. We perform 6 of those contractions, holding each one for 6 seconds. All right, next we'll be assessing the lateral fibers of the gastrocnemius. And so in order to assess those lateral fibers, we'll have the patient go up to 90 degrees hip flexion, 90 degrees knee flexion, back down to about 45, that half calf position, back that knee down to 90 degrees of hip flexion, full plantar flexion, and this time we're going full external rotation of the tibia. And so I'll be stabilizing, and I'll actually ask the patient to resist as I try to pull their leg into, their knee into extension. Ready, resist, 1, 2. If I notice any weakness there, I'll have the patient flip onto their belly. This time I'm going to be palpating the lateral femoral condyle, and palpating those origin fibers of the lateral gastroc, the lateral head of the gastroc, up at the origin. I'll slide distal down to where those lateral fibers start to form that Achilles and that myotendinous junction. And then I'll slide all the way distal to the lateral part of the calcaneus where the Achilles inserts onto the calcaneus. Once my DFAMAT's performed, I'll have the patient flip on their back again, back into the supine position. We're going to bring them up active 90-90, back that hip off to 45, half calf position, down to 90 degrees, full plantar flexion, full external rotation, and I want you to just push your heel into my hand for at a 10% effort for 6 seconds. Ready, pull, 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000. I will perform 6 of those contractions, holding each one for 6 seconds. The next muscle we will be assessing is the plantaris muscle. In order to assess the plantaris, we'll have the patient supine. We'll bring them up to the active 90-90. We'll back that hip flexion off to about 45, drop that knee down to 90 degrees of flexion. They're going to come into full plantar flexion, but for this one, no inversion or eversion. I'm going to be stabilizing the top of the foot and cupping the back of the calcaneus and trying to pull out into straight knee extension. So you're going to resist as I pull out. Ready, resist. 1, 2. If I notice any weakness there, I'll have them flip on their stomach to perform our DFAMAT. And so I'll palpate the lateral femoral condyle, kind of diving deep down into where I kind of feel that little ball underneath next to the lateral gastroc. I'll palpate the fibers there, and then I'll slide distal down to the attachment of the Achilles and the calcaneus and palpate those fibers down at the calcaneus. Then I'll have the patient flip back over onto their back to perform our PIC contractions. So we'll go up to active 90-90, back that hip flexion off to 45, drop knee into 90 degrees. We're going full plantar flexion. I'm stabilizing top of the foot. I want you to push your heel back into my hand at 10% effort for 6 seconds. Ready, pull back. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000. I would perform 6 of those contractions, holding each one for 6 seconds long. All right, the next muscle we'll be assessing is the popliteus muscle. In order to assess this muscle, we'll have the patient laying supine. We'll have them bring their leg up into active 90 degrees of hip flexion and 90 degrees of knee flexion. We'll back that hip flexion off to about 45 degrees, keeping about 90 degrees flexion at the knee. In this case, we're going to have them keep a neutral foot relative to plantar and dorsiflexion, and we'll have them fully internally rotate at the tibia. I'm going to be stabilizing at the back of the calcaneus. My action hand's coming into that mid forefoot, and I'm going to be pushing straight out into external rotation of the tibia as the patient resists. When I say go, resist, ready, resist. 1, 2. If I notice any weakness there, I'll have the patient flip onto their belly. And so my first palpation will be sort of right around that lateral femoral condyle, and diving kind of down to find that right around where the lateral meniscus in that joint line would be. And I'll palpate those fibers there, and then I'll slide medial and slightly inferior into that medial aspect of the tibia where the popliteus inserts. Right in that triangle there. And once those DFAMAT has been performed, we'll have the patient flip on their back again. We'll come up to 90, active 90-90, back off to 45, keeping 90 degrees of knee flexion. The patient's going to fully internally rotate at the tibia. I want you to just push your foot into my hand at 10% effort for 6 seconds. Ready, push. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000. I will perform 6 of those contractions, holding each one for 6 seconds long. All right, the next muscle we'll be assessing are the medial fibers of the soleus, or the medial portion of the soleus. In order to assess this muscle, we'll have the patient laying prone. We're going to have them pull themselves up into active 90 degrees of hip flexion. They're going to go into full internal rotation of the tibia and full plantar flexion. In order to test it, I'm going to be standing on the same side as the leg I'm testing. I'm going to stabilize in the back of the calcaneus. I'm going to go right underneath the head of that first metatarsal, and I'm pushing them straight into dorsiflexion of the talocrural joint. And so they're going to resist as I push straight down. Ready, push, or ready, hold. 1,000, 2, 1,000. If I notice any weakness, I'll keep them flexed. I will palpate the condyle, the lateral femoral condyle, kind of right at that fibular head, and dive just a little medial to palpate those origin fibers of the soleus. Once my palpations are performed there, I'll slide all the way distal to the Achilles tendon and sort of cut the back of that Achilles to palpate all of those fibers in the back of the Achilles or into the calcaneus. From here I can test as well the lateral fibers of the soleus. In order to do this, we'll have the patient prone as well for the PIC contractions for the medial fibers, and have them come back up to the 90 degrees of knee flexion, full plantar flexion, and internal rotation of the tibia. And I'm going to have them, as I stabilize, just push into my hand at the base of that first met. So they're pushing into plantar flexion for a 10% effort for 6 seconds. Ready, push. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000. I perform 6 of those at 6 seconds each. So now we'll check the lateral fibers of the soleus, or the lateral portion of the soleus. Patient is prone. They're going to pull their knee up into 90 degrees of knee flexion. They're going to go into full external rotation of the tibia and plantar flexion. Now I'm going to slide just distal to the ends of the 4th and 5th met. So I'm standing on the side of being tested. I'm going to cup the back of the calcaneus, and now I'm going to be pushing straight into dorsiflexion at the ankle at the base of the 4th and the 5th met. Ready, when I push, fight back for 2 seconds. Ready, push. 1, 1,000, 2, 1,000. To perform the DFAMAT for there, I'm going to go to that posterior medial aspect of the fibular head, kind of right around that lateral femoral condyle, palpate those fibers. Once I'm done palpating those, I'll slide distal to the attachment of the Achilles at the calcaneus and palpate the fibers at the Achilles. From there I can perform my PIC contractions. I'm going to have them come up into active 90 degrees of hip flexion, full external rotation at the tibia and plantar flexion, and I'm going to stabilize the back of the calcaneus. I want you to push with the base of these 2 toes here into my hand. Ready, push. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000. I would perform 6 of those contractions, 10% effort for 6 seconds each.